Today is Monday, the 27th of September 2021. This is a video for Health One users about the latest version of Health One 8.8.3.2836 and higher. This will be distributed in the coming days and weeks to all users. The main changes from the previous version are to do with the booster vaccinations for COVID and the online invoicing link to Billink we have. There are some other smaller improvements. You will see your version of Health One by clicking Help and About. And this is the lowest version you should have for these improvements, 8.8383 to 836. In the first video, I'm going to talk about the vaccination booster, the COVID vaccination. So I have a patient, Mr. Test COVID open. I'm going to do another vaccine on him. As you can see here, he's already had two vaccines, 12th to the 3rd and the 9th to the 4th. To give the booster, you click the same button here, Insert COVID Vaccine. And you will get a message here saying the second dose of the Pfizer vaccine was administered on the 9th to the 4th. Please confirm that you're registering either a booster or a shot 3 for the immunocompromised. In our case here, we're going to give the booster, which should be given at least 6 months after dose 2. The booster will always be Pfizer COVID, and your screen will be the same as you had for the first vaccine doses and will be filled in accordingly. So the questions have changed slightly, but you can change your answers here. Have you ever had anaphylaxis following a previous dose? If you said yes, then you would not be able to give it. If you've had an allergic reaction to any vaccine and you said yes, you would have to receive medical advice about it before you get it. Have you been diagnosed with, have you had any other vaccine in the last 14 days? We left that in, but it doesn't matter whether he has or not because any other vaccine could be administered at any time. So normally it'll be no. Have you been diagnosed with COVID in the last 4 weeks? If the answer to this is yes, you are not eligible until 4 weeks after the COVID diagnosis. Bleeding disorder is the same. If you say yes, you will just be warned about it. And the new one then is, are you pregnant or breastfeeding? And as you know, you can give the vaccine at any time to a pregnant lady now. So if you say yes, you should discuss the COVID vaccine with your healthcare provider. So given all of these things, you got your consent. You have the same screen as you had for your earlier doses. Everything is filled in. You have to have the PPS number, the vaccinator details, whereas the previous one here you had to have the claiming GP, which is vitally important. This is the person who's going to get paid. So it can't normally be the nurse, it has to be a doctor with a GMS number. This has always been the case with the COVID vaccine. The vaccinator, however, can be the nurse or the doctor or anybody who's giving the vaccine. So the injection site will be the left arm, and here we have automatically ticked the booster. The dose 3 is for immunocompromised patients, and you can click the eye here and you will bring up the chart for the immunocompromised from Chapter 5A of the HSE COVID guidelines. Once you've done that, you can simply say submit or save. I'm going to save in this case. And it's exactly the same procedure otherwise as you had for the other COVID vaccines. So to find your list of patients who need their booster vaccine, you can simply go to the COVID dashboard under Analysis, COVID Vaccine Dashboard, and we've added some features to this. So that if you take out the period altogether and you say, give me a list of all my vaccines ever done, this is a test source, so it's only 26. And I say, give me the those who have had dose 2. This is a new filter here. So now I have 13 records who've had dose 2. And I can now say, give me those who are dose 2 and greater than 80 years of age. And I'm down to my list. I can now print off this list by exporting it to Excel. I've got all their mobile phones here and ring each one of them or send them a text. And I have my list for my over 80s vaccination scheme. So this video is an overview of version 8832836 and the COVID booster vaccinations. We will do a separate video on the bill link and invoicing over the internet. Thank you.